The most important thing is commitment. And that's where it really gets difficult from my perspective, is getting people to actually commit to taking care of themselves. They spend a lifetime not taking care of themselves, and all of a sudden they have to change their lifestyle and take care of themselves. But it's worth the effort.
Diabetes reversal remission is absolutely possible. It's not easy. If it were, we'd just all be doing it, but it's absolutely possible for a large number of patients.
I think building an equation full of all of the lifestyle medicine things that you and your patients already have access to. So exercising regularly, eating whole foods, we're going to hear a whole bunch of good things about that in a bit. Managing your stress, I really can't emphasize that one enough. I think it's a huge roadblock that we don't spend enough time talking about. Prioritizing sleep and maintaining a healthy weight.
We talked a lot about, cooking at home, and that's just because there are so many benefits, right? So our health benefits are going to be things like improvements in biometric data, so improved blood sugar control, better portion control. We tend to have a higher nutrient density when it comes to the foods that we're preparing ourselves. And this also helps strengthen other lifestyle habits. So if we're cooking more at home and we're feeling like we're eating well, we're probably going to be sleeping better, more motivation to exercise, right? So all of those 6 pillars of lifestyle medicine slowly but surely start to get worked on. And then of course there is this financial benefit as well.
So if you look at page 81 in Good Food, Great Medicine, you'll see a section on gestational diabetes, and that came out with the 4th edition. And so Dr. Hassell was just generous enough to build it with us. Our patients had less anemia, less gestational diabetes, less insulin-dependent gestational diabetes, and for the group, there was only 1 C-section, and she had already planned the repeat C-section. And so less surgeries, fewer unnecessary surgeries. So my question is, why isn't everybody doing this?
One of the standard questions I ask is, what do you want life to look like in 5 years, 10 years, 15 years, 20 years, depending on their age? So I might ask a 40-year-old who's on blood pressure drugs, do you want, how vital do you want to be when you're 70, 80, 90? Do you want to be able to play with your grandchildren? Because you're already 15 pounds overweight and on blood pressure drugs, and these blood pressure drugs are going to do these harms, including increasing your risk of diabetes.